describe the different levels? So we have different levels for classes, so FM1, 2, 3, and 4. Can you just briefly describe what we learn in each of those classes and how they sort of build on each other?
Yeah, level one in hybrid versus 3D, you're going to learn the center of coordination, the center that works for the more movement in the major plane, so like frontal, sagittal, horizontal plane. So this is help you to treat any pain that are related to motion. So if I move, I have that pain, will be strongly related with the center of coordination. Level 2 will be more related with the center of fusion, where multiple vectors converge. So for complex motion or for no motion, because the nerve, they go through that area where loading is not so evident. That is why the patient comes into your office and look, my shoulder hurts during the night. But then I play tennis, I can play, but then when I driving back, it hurts again. That is a typical condition where the central fusion are related to this problem, and you can improve complex gesture, equilibrium, strength. So this is like at the core of level 2. Of course, level 3 will introduce the inner fascia, because the myofascial pain is not just musculoskeletal, it's visceral. So we will try to understand the anatomy of that. We try to understand what does it mean, like bloating, how you address bloating, reflux, incontinence, dysmenorrhea, dysphagia, dysphonia, all this kind of dysfunction that they don't have a pathology behind. So the investigation are negative, but the patient have maybe a miserable life due to this problem. So don't believe that myofascial pain is a minor symptom. It can be a major, really can affect dramatic quality of life. And through this additional anatomy, you understand that we don't work just proximal distal, but we work in 3 dimensions. So it's we call a global approach, because you never know if the knee pain is a musculoskeletal region or is a visual somatic region. People that have a bladder infection for years will generate compensation, will hit the knee. So this knee will hurt even at rest, and nobody's able to figure out what is wrong. It's a visual somatic problem. So level 3 is not just for treat the visual problem. And so, musculoskeletal people say, okay, it's not for me. Level 3 is for treating the global patient. So you can address also symptoms like a heel pain, bilateral elbow pain, that are not a musculoskeletal region, but visual one. It has to be fully understood. It's more common what it look like.
Excellent. And then is there a level 4?
Of course, level 4 is about superficial fascia. So, everybody know about lymphedema, everybody know about the painful cellulitis, everybody know about eczema, paresthesia, dysesthesia. So superficial fascia is strongly related to lymphatic system, is strongly related to the infrastructure, the lobular fat, is strongly related to all the superficial nerve. So when superficial fascia is altered, on top of all the other, problems you can have with the visceral fascia, musculoskeletal fascia, deep fascia, you can have also that one. And of course, we can give the example of fibromyalgia. Fibromyalgia for sure is a level 4 patient, no doubt about that. Complex regional pain syndrome, for sure there is a multiple nerve entrapment that will generate a disorganization of the autonomic system. So level 4 give you a way, a key, a flow chart to understand what the patient, how the patient is so complex, how the patient is so systemic disorder.
That's perfect. Yeah, and these classes have just been a wonderful addition to our curriculum. It's how I practice, it's how our teachers practice, and it's just such a wonderful blend within all of our other techniques that we teach and within our thought process. So it's just been super complimentary, and we're honored to be able to bring your methods to the US.
Of course, it's our pleasure, and hopeful to see you at upcoming course.